Good evening, all of you. Welcome to today's podcast. Myself, Dr. Nikita this side from Biomedical team. First of all, I would like to welcome to our special series where we speak with leading cardiologists to simplify heart health without making your heart skip a beat. Today, we are discussing a condition that affects millions across India, that is heart failure. And to guide us through this important topic, we have with us Dr. Harnish Singh Bhatia, consultant cardiologist at Fortis Greater Noida, someone who has been at the forefront of managing complex cardiac cases with precision and compassion. Welcome to the podcast, Doctor.
Thank you so much, Dr. Nikita.
Yeah. Doctor, firstly, we would like to understand about heart failure. So let's start with this big one. The term heart failure sounds terrifying. Many people imagine the heart has completely stopped working. So what does heart failure mean? Could you please help us understand that?
Yeah, so I think this is the most common doubt that people have in their minds. Heart failure, when they hear this term, they think that heart has completely stopped working, but that's not true. So basically, to understand what heart failure means, we have to understand what the function of our heart is. Just like any other organ in the body, heart has its own function. And heart is considered to be central to the functioning of all the organs in the body. That's because the function of heart is to pump blood to all the organs in the body. So every organ in the body receives its nutrition through blood, which is pumped by heart. So the function of heart is to pump blood it collects blood from the venous end, from all the organs, sends it to the lungs where it gets oxygenated, means it gets mixed with oxygen, and then the blood comes back to the left side of the heart, and the left side of the heart pumps it to the rest of the body, including all the organs, which includes brain, liver, kidneys, skin, every organ, lungs, every organ of the body, and that meets the oxygen requirements of the body. And so now that we know what the function of the heart is, it's easier to understand what heart failure is. So basically, heart failure is when heart is not able to pump enough blood to meet the oxygen and nutrition requirements of all the organs of the body. So that means that the heart is still functioning, it is still beating, but it is not functioning to its maximum capacity so that it is able to meet the requirements of the body. And when that happens, because the heart is not functioning adequately, there is accumulation of blood inside the heart and as well as behind the heart. And behind the heart is lungs. So there is accumulation of blood, or we can, in simple language, we can call it fluid, any fluid in the lungs, which leads to the typical symptoms of heart failure, which we will see later on. So heart failure is like a chronic medical condition. It is not an acute condition where heart has stopped working. It just means that heart is not pumping blood as efficiently as it normally should.
I think it's quite clear that what a heart failure now means to us. That's why I think if the heart stopped, we wouldn't have been having this conversation.
Exactly.
So
And that's what is cardiac arrest. So
Yes.
we need to understand the difference between heart failure, cardiac
Yes.
arrest, and other similar
So
terms.
that leads us to the next segment where we will understand about from you what is heart failure versus what heart attack. So many people confuse this term heart failure, sir, with heart attack. So
Yeah.
are they same, or could you please help us to
So
understand
I
that?
think people don't just confuse heart failure and heart attack. People also confuse another term which we discussed just now, cardiac arrest. So these three sound very similar. For a layman, they could all mean the same thing, but for a medical person, we know that they're all completely different things. So heart failure, we know heart failure is where it's a long-term condition where your heart has become weak and it cannot pump blood properly. It is still pumping blood, but it cannot pump it properly enough, efficiently enough. Whereas heart attack is an acute condition. It's a sudden condition where we have three blood vessels which supply the heart. Their names are LED, L6 and RC, which are not important for general language, but what we need to understand is any one of these three arteries is completely blocked, and that leads to the lack of blood supply to that particular part of the heart which that artery supplies, and that leads to sudden onset of chest pain, It can lead to perspiration. It can also lead to breathing difficulty, just like heart failure. But main symptom is chest pain. Sometimes there can be atypical symptoms, usually in females and elderly patients, where they may have either no symptoms or some symptoms like uneasiness or sweating or something like that. That is what is termed as a silent heart attack, where there is no chest pain. So a heart attack is an acute condition. Heart failure is a chronic condition. Heart failure means decreased pumping. Heart attack means one artery is blocked, leading to chest pain. Whereas cardiac arrest is a third subset, which is the most serious of all of these conditions, which means that the heart has completely stopped beating because of any reason. A heart attack can lead to cardiac arrest in an acute setting, and it can also lead to heart failure in a long-term setting, in a chronic setting. So, heart attack leading to sudden stoppage of the heart because of any reason, either an arrhythmia or a mechanical complication. It could be anything. For layman, it's important to know that heart can stop beating on a heart attack, and that is called as a cardiac arrest. And that's when we need to do the chest compressions, or what in medical language what we call it as a CPR, cardiopulmonary resuscitation. So yeah, these are the general differences between heart attack, heart failure, and cardiac arrest.
Absolutely, sir. From this, I can understand that a heart attack is the sudden roadblock, and heart failure is when the engine gradually loses its power.
Correct.
Yeah. So to this, sir, we would like to understand why earlier in India, and like there are many studies which suggest that India occurs almost a decade earlier in as compared to the Western population. Why is that? Yeah.
So absolutely, not just earlier, it's also true that the incidence of heart failure in India in a general population is much higher compared to the Western population. We need to understand why. So I think why heart failure is much more prevalent in India compared to the Western population is basically whenever you get a heart attack, some part of your heart stops working, and that in the long term can lead to heart failure. So which we have understood by now. Now, whether a particular part of heart will become completely permanently dysfunctional or not depends on how early you open the artery after the onset of the heart attack. So in Western population, because they have a very robust first aid system, very robust ambulance system, even if someone's living in a very remote area, ambulance will quickly pick them up and they'll bring them to the healthcare, and then they will get revascularized, their artery will get opened, and that's why the blood supply of the heart is restored. That's why the muscle does not lose its power in the long term. That's why the incidence of heart failure is less in the Western population. While in India, if somebody gets a heart attack, sometimes, especially in the remote areas, them reaching the healthcare happens very late, and that is the reason the opening of the artery, which we call as revascularization, happens very late. And because of this late phenomena, that particular part of the heart, that particular muscle gets permanently becomes dead, and then it leads to development of heart failure in the long term. So that's why incidence of heart failure is much higher in India. And why it happens earlier is, see, there are lots of reasons why India is having increased incidence of coronary artery disease and heart failure earlier compared to the Western population. I feel the most important reason is because we have risk factors which are happening earlier. Like India has now become the diabetic capital of the world, and diabetes onset in India is 10 years earlier compared to the Western population. So quite naturally, heart failure occurrence also will become 10 years earlier compared to the Western population. Secondly, we in India, we have a very sedentary lifestyle. Those people who have been diagnosed with diabetes and hypertension, the percentage of them having their BPs and sugars controlled is also pretty less. There's a data which says half of the Indian population, half of those who are actually diabetic, they don't even know they're diabetic. Half of those who are diabetic and who know they're diabetic are not taking treatment. Half of those who are taking treatment are not taking adequate treatment and not meeting their sugar and blood pressure targets. So such a poor control of blood pressure and diabetes will naturally lead to earlier occurrence of heart failure, because it is a risk factor for heart attack and ultimately development of heart failure. I think thirdly, our diet is also very much rich in salty food, spicy food. That also, because of increased salt, there is increased water intake inside the blood vessels, and that also ultimately leads to heart failure. Tobacco use, especially chewable tobacco, is very frequent in most parts of India. I think that is also a risk factor for development of heart artery blockages and as well as heart failure. And lastly, there are some infectious heart diseases like rheumatic heart disease or infective endocarditis, which are also more common in the eastern part of the world compared to the western part, especially in India, and that also leads to heart failure because of the diseases of the valves of the heart. So I think these are all the reasons which are contributing to the earlier occurrence of heart failure in India.
Absolutely, sir. To this, I guess we Indians are hardworking, but unfortunately, our hearts are sometimes overworked too.
Yeah, but
So,
what we consider as hardworking is
yeah.
just work. Very few percentage of India is actually working out for the sake of their heart health
Yes,
and their general well-being. So I think that is the problem.
yes, absolutely, sir. To this, we would also like to have your insights like symptoms that we should watch for, or what are the common warning signs that patients should, never ignore, if you
Yeah. So
can tell.
symptoms basically depend on what the pathophysiology is, what the heart failure is. So, like we've discussed, it is a reduced capacity of the heart to pump blood. So, because the heart is not able to pump blood forward, that blood is going to get accumulated backwards. And when the blood gets accumulated backwards, whatever is behind the heart, so behind the left side of the heart is the lungs. So, the blood gets accumulated in the lungs. That's why there is breathing difficulty because of fluid in the lungs. Number one. Behind the right side of the heart, there is legs, there is systemic vasculature. So when the blood gets deposited in the legs, there is pedal edema, or in what we call in general languages, swelling in the legs. So swelling in the legs, there's feeling of abdominal fullness, especially on the right side of the abdomen where the liver is, because of the congestion in the liver. Decreased food intake, nighttime cough, because when we lie down in the night, all the blood which is there in the legs when we're standing up gets to your heart, and the heart is not able to sort of absorb that extra blood, which leads to worsening of heart failure. So nighttime worsening of cough as well as breathing difficulty. So these are the common symptoms. Weight gain is the most common symptom. I think it is one of the most common symptoms which patients with heart failure can use to know whether their heart failure is worsening or not. So all my heart failure patients who are being managed with medicines, I tell them to keep checking their weight every once in a while at home, because if they are feeling like their weight is suddenly increasing over a period of last 1 to 2 weeks, that means their heart failure is worsening. We can identify that worsening of heart failure before it gets to a stage where they need to be admitted to the ICU.
Absolutely, sir. And I think the audience should take away from this particular segment is that if climbing one flight of stair feels like scaling a Mount Everest, it's time to see a doctor.
Absolutely,
Yeah.
absolutely. So
So,
that can
sir,
be because of the congestion of the blood in the lungs, and your lungs you may not be able to handle that extra fluid, and you can feel like it's very difficult to climb stairs, and you can feel breathlessness. So correct, you're right.
yes. So, once diagnosed, what can patients expect? Is heart failure manageable, sir?
Absolutely. If you asked me the same question 15 years back, I would probably say presence of heart failure is like presence of cancer. You are going to have a reduced lifespan. But currently, today, if we see, the scenario has changed. We have a lot of treatment modalities for heart failure, starting from lifestyle changes in the form of reduced water intake, some form of reduced heavy exercises, but doing more and more of aerobic exercises can actually make your heart function better. So aerobic exercises can help. Apart from this, I think after the lifestyle changes comes the medicine, and we have a lot of medicines available in the market. Commonly there are 4 pillars of heart failure, which almost all the heart failure patients are on. Almost all the cardiologists will give you those 4 pillars of heart failure. You can, if you suspect to have heart failure, you can ask your cardiologist about it. Apart from this, I think now we have a lot of devices for heart failure in the form of CRT devices, in the form of ICD, and there are other devices also which are coming up. So lifestyle changes, medicines, and devices, and as well as other things like valvular interventions related to the valves, AF ablations, arrhythmia ablations. So a lot of therapies are available. So definitely heart failure can be managed. It can very well be reversed in majority of patients too, provided they live a healthy lifestyle and they take their medicines and properly, and they follow the advice of their cardiologist.
Yes, today I guess heart failure is not a full stop. It's a comma. With the right treatment, patients can live active lives.
Very true.
So, to this, sir, emergency red flags. Now there's a red flag and a green flag. So when should someone rush to the hospital immediately?
So if you're feeling breath, so there are two ways which you can rush to the hospital. One is when you're having symptoms since a very long time, and now you need to, when do you need to get evaluated? So I feel if you're having difficulty in doing activities which your peers can do very smoothly, I think you need to get evaluated. Evaluation can be simple ECG, simple echo, simple treadmill test, or if required, there's a simple blood test called NT-proBNP, N-terminal pro-brain natriuretic peptide, which can diagnose heart failure very well. These tests can diagnose heart failure in 99% of patients. So these simple tests you can do. Apart from this, if you're talking about emergencies, then yes, if you're having sudden onset of breathing difficulty, like you're sitting and you feel like you just can't breathe, you feel like you have to take a very deep breath to be able to feel normal. I think that's a red flag sign. If you're having sudden onset of weight gain, like we discussed, sudden onset of swelling in the legs, sudden onset of abdominal fullness, which has happened in the last couple of days, I think these are the red flags which you need to take very seriously. Ignoring them can lead to going to a stage where management of heart failure becomes very difficult. And it's very important to diagnose heart failure early, because if you diagnose it early, we have a lot of treatment options, and most of these treatment options are most effective when they're started early in the onset of the disease. So yes, I think these are the things which one should watch out for.
Absolutely. For the audiences watching us, the body whispers before it screams. So do not miss or ignore those whispers, I would suggest.
Yeah.
So before we wrap up, sir, what message would you like to give to the patients and the caregivers in this segment?
So, heart failure sounds like a scary diagnosis, like we've already discussed. But like you said, in your words, it's a comma, not a full stop. And I think that's the most important thing one needs to understand. It's heart failure is a serious condition, but at the same time, it's a very well manageable condition. We have a lot of therapies these days. Majority of patients with heart failure can live almost normal life. They can live as long and as good quality of life as a person without heart failure can live. So it's definitely not a full stop, but at the same time, it's also very important to not ignore the symptoms. If you're having symptoms, get diagnosed early. Once you have been diagnosed, make sure that you're taking your medicines regularly, because in our clinical settings, most of the times what we see is when you start the medicines for heart failure, patient suddenly feels better. And when they start feeling better, they tend to stop their medicines. And the problem is, once you stop the medicines, you can go back to the previous stage of heart failure or even worse sometimes. And there's a data which says that once you feel better with heart failure medications and you stop them, the effectiveness of those medicines reduces when they're reintroduced later. So never stop your medications. If you have heart failure, like I said, I tell all my patients, monitor your weight regularly. Dietary advice and lifestyle advice, very important. More important than any medicines, any device, any surgery for heart failure is improving your lifestyle. Stay physically active and regular follow-up. Once you feel better, don't stop your follow-up with a cardiologist. Keep going for a regular follow-up. And yeah, so with all of these, heart failure can be very well managed if taken care of early.
Absolutely, sir. And to the audiences, we would like to emphasize that take care of your heart. It's been working for you non-stop since before you were even born. So thank you so much, Dr. Bhatia, for simplifying such an important topic with clarity and warmth. To our listeners, remember, heart failure is serious, but awareness is powerful. Early diagnosis, discipline, and right medical care can truly change outcomes. Until next time, stay heart smart and heart strong. And don't forget to like, share, and subscribe to this podcast where we had a heart-to-heart conversation with Dr. Harnish Bhatia. Thank you so much.
Thank you so much, Dr. Nikita.